Name signs in gastrointestinal examination. Murphy's punch sign. It is also known as Pasternak sign, Goldflum sign, and costovertebral angle tenderness. Method of examination. The examiner places one hand over the costovertebral angle, and gentle percussion is done over that hand with a closed fist of the other hand. It is said to be positive when there is tenderness on percussion over the costovertebral angle. The test is positive in patients with an infection around the kidney, such as paranephric abscess, pyelonephritis, or hemorrhagic fever with renal syndrome. Murphy's sign. It is also known as Sweeney's sign. Method of examination. Ask the patient to breathe in deeply and palpate for the gallbladder in the normal way. At the height of inspiration, the breathing stops with a gasp as the mass is felt. It is useful for differentiating pain in the right upper quadrant. It is positive in acute cholecystitis, but negative in cholecystolithiasis, chronic cholecystitis, uncomplicated cases of gallstones, ascending cholangitis, and pyelonephritis. Courvoisier's law or Courvoisier sign or Courvoisier-Terrier sign. This states that, in a patient with jaundice and a palpable gallbladder, the cause is unlikely to be gallstones, obstructing the common bile duct, and therefore presumes the cause to be an obstructing pancreatic or biliary neoplasm, until proven otherwise. However, the converse is not true because the gallbladder is not palpable in many patients who do turn out to have malignant bile duct obstruction. Boas Sign. It is defined as hyperesthesia to light touch in the right lower scapular region or the right upper quadrant of the abdomen. It is classically seen in acute cholecystitis. Rovsing sign. Rovsing sign is said to be positive if there is pain or tenderness over the right lower abdomen or right iliac fossa when pressure is applied over descending colon or left lower quadrant of abdomen. It is due to the phenomenon of rebound or cross tenderness. It is seen in acute appendicitis with peritoneal irritation. McBurney sign. Deep tenderness at McBurney's point, known as McBurney's sign, is a sign of acute appendicitis. Aaron sign is the referred pain felt in the epigastrium upon continuous firm pressure over McBurney's point, indicative of chronic appendicitis. Psoas sign. Right lower quadrant pain, with extension of the hip, or with flexion of the hip, against resistance. It is seen in acute appendicitis. Obturator sign. Right lower quadrant pain, with internal or external rotation of the flexed hip. It is seen in acute appendicitis. Dunphy sign is the sharp pain in the right lower quadrant with coughing. Markle sign or jar tenderness or heel jar test is the pain in the right lower quadrant of the abdomen by dropping from standing on the toes to the heels with a jarring landing. Both of these tests are found in patients with localized peritonitis due to acute appendicitis. Rebound tenderness or Blumberg sign or the Shyotkin-Blumberg sign. Deep palpation of the viscera over the suspected inflamed appendix, followed by sudden release of the pressure, causes the severe pain on the site. It may be seen in peritonitis, secondary to any abdominal irritation like acute appendicitis, ulcerative colitis, etc. Cullen sign. It is the bluish discoloration of periumbilical region or central bruising. It indicates intra-abdominal bleeding, for example, ruptured ectopic, aortic rupture, or hemorrhagic pancreatitis. Gray-Turner's sign. It is the bluish discoloration or bruising of the loins or flanks. It indicates retroperitoneal bleeding and may be seen in hemorrhagic pancreatitis. To get more such high-yield medical content, don't forget to subscribe. BasidiaMED. The easiest and fastest way to take advanced clinical history.